Hi, it's Honey again, back from my 4-month update video. In this video there's been a lot of changes besides my backdrop. I got to the bottom of a few of those things I spoke about in the last video, like my kidney issues. I've been to a consultant that was already treating me for having donated a kidney previously, and she went back through my results all the way back to 2011 and was able to show me that basically my GP's overreacting a bit. Nothing's really changed. My kidney function level has always been anywhere between 51 and 58%, so it being at 56% is very ballpark. And again, I was mentioning like the creatinine levels in my blood last time. My best results have been like 118 and up to 130, so to get a result of 136 is still again roughly ballpark, so there's no concerns there anymore, fortunately. Moving on from my general health to my hormone related stuff, I've got my blood work results back and I was able to find out that previous to starting HRT or blockers I was at 15.8 nanomoles per litre of testosterone, and now since both the blockers and the 6.4 milligrams of estrogen delivered in a patch from my 100 Everol patch, it's dropped to 7.2, and so it's more than halved. My private doctor who dealt with the blood work sent me an email saying that was still a bit higher than we would want, and she's since prescribed me an additional patch which I take, which is an Everol 50, so it's literally half as it would suggest, and it's 3.2 milligrams of estrogen delivered via that. As you can see, that's the original patch, and then this is the new one. It's not quite half the size, but it is significantly smaller, and it's easier to apply than the big one, I suppose, and they both tend to stay on quite well, although I am finding the longer I'm wearing these patches in terms of repeat application, both my legs are getting sore spots on them now from them, and it can be quite itchy and uncomfortable at times. So my next set of blood work will be in January, and I'm hoping that I can maybe persuade my private GP to change me on to pill-based delivery of my estrogen. There's been no change at all to my finasteride. I'm still on 5 milligrams daily of that, and I'm still getting all the effects I've mentioned previously from that, like the hair growing back in on my head is still continuing, and again it's going to be a very long process, and I'll probably be bringing it up for a long time yet to come. I had previously said that it can cure dandruff. I must have just been going for a good patch at the time, because it certainly hasn't. My head seems to have erupted back into flakes all over the place again at the moment, so HRT or T blockers are not going to cure dandruff. It was something that I thought I'd noticed at the time, but clearly I was wrong about that. So I've been on the increased dose for a month now, obviously, and I have noticed that both my chest has begun aching and growing again. I know I've always said, yeah, my chest aches and grows, but it's been accelerated. I'm definitely feeling it more. Also, my strength and muscles are being affected now as well with this additional patch. I'm definitely noticing my body aching a lot more after I've been going to the gym, and I'm losing strength, especially in my upper body. In some of the classes I'm really struggling to keep up and managing to do press ups. Some of them can be a real killer, and I am definitely losing strength. I know it's something that can be not rectified but managed, because obviously genetic women manage to do press ups just fine, but obviously for me I've not had to try this hard to do press ups and things like that before, and it is obviously as well impacting on other areas like my legs and things like that. I can really feel it after I've been to the gym now. So anyway, with the increased dosage, I am looking forward to seeing what my next lot of blood work will say in January. Hopefully my testosterone will have been driven down more again by the estrogen. My current levels are low enough that the computer was flagging me as somebody that may need treatment for testosterone replacement therapy, which is ironically funny because obviously that's the opposite to what I'm after. So besides my blood work in January being on the horizon, another thing that's coming up more and more is the fact that now I have my referral to the gender clinic at Northampton. That went through successfully. I'm waiting my first appointment. Sometime between now and receiving that appointment, I need to come up with a plan and a strategy for coming out at work and going full time, getting my name changed, etc. I've looked into it. I'm probably going to go with the free depol version for changing my name. I will get it looked at or witnessed by a lawyer, which I've been using for a completely other different matter, so there won't be any trouble getting that signed off. But at the same time, I've got to come up with a strategy for coming out at work and making sure I know my rights, etc., because I don't think they're going to be terribly impressed. So I need to make sure I have a strategy in place and a method for just protecting myself and making sure they're aware of everything and that it all goes as smoothly as possible. When I have got one in place and I've gotten any advice I need and all the rest of it, I'll do a video separately about coming out at the workplace, same as I did the video about coming out to the family. So hopefully that'll be of some use to you as well. In the meantime, if you follow me on Instagram and Google Plus already, then keep your eyes peeled for the coming week, as it'll be Halloween and I have a shoot coming up for that. So now I've got my general health update out of the way and we know I'm back to normal, or was never not normal, or this makes no sense.